We're going to look at the thoracic cage. So looking at your chest area. The thoracic cage itself includes the ribs. So the ribs are considered part of it. The thoracic vertebrae, sternum will break apart a little bit, and then the costal cartilage that is part of your ribs basically. It supports the pectoral girdle, the chest area, your upper limbs, and very important for protection as far as your lungs, your heart, some of your upper abdominal cavities, or even like your liver and things like that. And then it also helps with movement in breathing. So if we talk ribs, there's 12 thoracic vertebrae. So there's typically 12 pairs of ribs that are going to attach to those vertebrae. The first 7 are called true, and they join the sternum directly. I'll bring this out in a second. The remaining 5 are called false ribs because they don't directly attach to the sternum. The first 3 pairs are going to join cartilage, and then your bottom 2 ribs are called floating ribs. So I'm actually going to kind of start backwards if I look at this. So floating ribs 1 and 2, notice they just end. They don't attach to anything. They come out, they're short, there's nothing. And then I'm going to look at the next few. They attach to the sternum, but this costal cartilage is going to actually come up and attach. If I look at my top 7, so 1, 2, 3, 4, 5, 6, 7, they attach directly to the sternum. So true ribs attach to the sternum, false do not, and then floating are your 2 very bottom ones that don't even attach to cartilage. So they basically are just floating out there. They are the bottom 2. If I look at a rib, there's the shaft, the head, the tubercle. The head, you should know this, the head is the part that actually joins or articulates with the vertebrae. The tubercle articulates with the transverse process. So we'll look at a diagram of that. Sternum, which is your breastbone. So your sternum would be your breastbone, and it is actually broken into 3 parts. I expect you to know those 3 parts. Manubrium is the top part. The body is the long center part. And then the xiphoid, it starts with an X, but it's pronounced xiphoid. The xiphoid process is that little tip at the bottom. If you've taken any CPR classes and they talk about kind of your 2-finger area, basically you kind of feel for this bottom area of the chest cavity or the bottom part of your sternum for doing CPR. And then that sternum will actually help you to push or press when you do CPR. And sometimes they'll actually like crack ribs doing CPR. So sternum, 3 parts. Make sure that you know those. So if I look at the diagram, it's also labeled manubrium top, body, long middle part, xiphoid process, the little part at the bottom. And here also shows your 12 ribs, 7 true, 5 total false, the 2 bottom are your floating. And that's all there is for the pectoral girdle.